I'm very happy to have joining me this morning one of our friends from Wisconsin Institute for Law and Liberty. So grateful for this organization, particularly because, well, and I mean, we have a lot of optimism with the incoming President Trump administration, all the exciting picks in his cabinet and beyond. And however, we're still going to need a lot. We're going to need organizations such as Wisconsin Institute for Law and Liberty to be ever vigilant because the left, although they realize that we're onto them, that doesn't mean that they're going to stop doing what they do. And so subsequently, we need, as I said, an organization like Wisconsin Institute for Law and Liberty. Joining me from Will is Deputy Counsel Cara Tolliver. Good morning, Cara. How are you?
I'm great, Meg. How are you?
Very good. Merry Christmas to you. We were
Thanks.
chit-chatting off air, maybe a little bit more introspective about the Christmas holiday and how we both agreed that we prefer Christmas Eve over Christmas Day. And shame I shouldn't even say that on the air, but it just seems as if it's so much about the anticipation. But the lesson, of
hmm
course, in all of that is anticipating the birth and celebration of our Savior Jesus Christ. But so, and I can't. There's no good way to transition to this topic. But I do know that the press release that was sent out to notify those about this did say Christmas miracle. So maybe we can find a miracle in all of this that transpired as a result of Will's work to target the Biden administration. I don't know how many times Will has had to sue the Biden administration, but it looks as if in this case you were quite effective in getting them to back down.
Yeah, so this particular issue with the Biden administration concerned a regulation, a new rule from the Centers for Medicare and Medicaid Services, so CMS. So they recently finalized a new rule in early December, which affects kidney transplantation in America. And thanks to public comments filed by Will and others, the agency rightfully decided to back away from certain components of its initial proposal that would have required kidney transplant hospitals to submit health equity plans to the agency under the threat of penalties. So this rule, known as the Increasing Organ Transplant Access Model, creates a sort of payment scheme that implements a scoring system through various new requirements and incentives related to the kidney transplant process. So under the rule, essentially, hospitals will be scored, and their performance on certain metrics and criteria will inform federal Medicare payments that are either owed to participating kidney transplant hospitals or owed from them. The model aims to actually incentivize hospitals to boost organ transplantation access, which has the potential to be a very good thing, of course. But because CMS's original proposal requiring health equity plans would have encouraged transplant hospitals to employ racially discriminatory considerations against potential kidney transplant candidates and recipients, Will voiced its constitutional and legal concerns about the model in a public comment back in July. And fortunately, following those comments, CMS will at least no longer require participating kidney transplant hospitals to submit these health equity plans. So the rule does leave the door open to allow hospitals the option to submit the voluntary plans. I think, though, you know, the fact that hospitals can still choose to submit these voluntary plans. I mean, they should do so cautiously, considering that the implementation of race-based policies in medicine could subject them to private legal action and other ramifications, especially as we move into the Trump-Vance administration. So hopefully some of these factors will create further deterrence to avoid any voluntary implementation of a racially discriminatory organ transplant policy of all things.
Man, maybe we need a DEI eradicator czar or something, because I mean,
Yeah.
this is, and I mean, you can correct me if I'm wrong, Cara, because I did not go to med school, but I was under the impression that um, every race it has the potential to have problems with their kidneys, and so why would we, or why would any medical organization, or why would our federal government try to, um, I guess, be discriminatory towards a certain race, meaning white people, I presume, because it's sort of, unfortunately, bad health can be an equal opportunity for all of us. I hate to say it that
Right.
way.
Yeah, you're exactly right. I mean, unfortunately, the federal government and many out of control bureaucrats have for too long placed us on a very unconstitutional course to remedy broad racial disparities in furtherance of racial equity and what the Biden administration has explicitly referred to as a, quote, racial equity agenda. And racial equity in the context of kidney transplants means simply looking to race to allocate organs to ensure an even balance between racial groups. So, in other words, too many white people are getting kidneys, maybe not enough black people, maybe Hispanics are getting more, Asians are getting less, that kind of thing. Let's smooth that out. That's the ultimate goal of racial balancing. But as you pointed out, that is not how disease and need work, is it? I mean, when you're sick and you need a kidney, you need a kidney, and it doesn't matter what race you are. And, even when we see higher rates of disease in certain racial groups, these folks are generally sick for a host of reasons unrelated to their skin pigmentation. So we need to be looking at the individual and making decisions and health decisions based on that individual's need and in that individual circumstances, because a critically ill patient's level of need isn't going to change with their skin pigmentation. And of course, race isn't going to make that person any more or less worthy of an organ transplant.
I guess it's sort of so absurd that it's hard not to be a little bit cynical or sarcastic about it. But I mean, when presented with the logic that you have just shared, how do people on the left, I mean, presumably those in the Biden administration, how do they react to it? I mean, how is it that they have such a completely opposite way of thinking when it comes to, I mean, something as absurd as, well, we're going to deny someone a kidney transplant based on their color?
It's almost been like a message has been peddled for so long, so it's not even like, it's like the sky is blue, the sky is blue. Everyone knows the sky is blue, and you repeat this message that over and over and over, and like people kind of start internalizing it as a truth, whether it is a truth or not. So I mean, like when you point these things out, I mean, just everyday people who don't have any reason to have a necessarily a policy stance on something like a hard policy stance one way or another. It's just like, oh yeah, that does make sense. I think this is just one of these things. I mean, I think there are certain like true believers of these types of policies, but I think for a lot of Americans, it's we've all heard this message for so long, and maybe on its face, like, oh, racial equity. When you stop to think about what that actually means, like we're just looking at race and trying to even out results, and we don't care about, what those actual people. There are people under those statistics. They're not just statistics. I mean, there are people that are in need under those. When you think about what that means, and when you think about what a policy that works to achieve that, it's not. There's nothing fair about that. There's nothing that is logical about that. So I think some of this is sort of you know actually explaining this and getting back to basics with what these policies actually mean when they're implemented. You're right; they don't make sense.
Well,
And you don't want to find yourself on the other end of a policy that's discriminating against you in this way.
well, can you
Nobody would.
imagine? I mean, needing a kidney transplant, and the first question they ask, well, presumably you're face to face with a physician, but I mean, well, I'm sorry, you can't get a kidney transplant because of your skin color. I mean, imagine the outrage if a black person or a non-white person was told that, I'm sorry, you can't get a kidney transplant because of your skin color. It's only white people that, well, and I presumably other, well, whatever, Caucasian looking human beings that have to be subjected to this.
Yeah, it's reached a really unfortunate level. I mean, and given the history that, where we have seen outright discriminatory policies in this country, and the earlier half of last century and before, like, this should be no brainer stuff. We just should we shouldn't be looking at race. We shouldn't be talking about race in this way. There's nothing wrong about acknowledging individual differences and appreciating people's differences. But that exact thing when you're actually doing that, you're not using a person's race against them to make any kind of decision about what they need or about who they are. You're just treating that person as an individual, the way that you should be. So, I mean, we really hope that the new incoming administration will take a pledge for true equality here and stop dividing Americans by race, especially when it comes to health care and the apportionment of life-saving treatment and care. I mean, that should never in a million years look to race.
Well, and let's be clear, it's not as if they all of a sudden saw the light. Oh, I mean, maybe there's a chance that
No.
an individual may have seen the light on Christmas or something, but this is in response to comments from your organization and others that, I mean, it's just kind of like a wake-up call. Hello, what you are trying to implement is actually racist under the guise of being, I don't know, fair and equitable.
Yeah, and unfortunately, this isn't even the first time. So the government has already advanced certain earlier efforts to address racial disparities in kidney transplantation specifically. So, for example, it's called the Kidney Allocation System of like 2014, I believe it was. And the changes that system made to waiting list patients were expected to benefit certain minority groups. And in fact, the data has shown that the system has been working to pull organs away from some patients to give it to others purely on race. Thankfully, this rule does not further compound, does not, like, in a mandatory sense, further compound the effects of that prior system. But I mean, these are all things that need to be addressed and need to be undone. So I mean, some of these things the Trump-Vance administration can do by not enforcing these policies, by revoking certain regulations that are implementing these racially discriminatory implementations of health policy. So there's a lot of work to be done, and I think, regardless of what leadership is in power, I mean, Will is going to be here monitoring those things and standing against policies like this that are totally unfair, totally unconstitutional, and just totally immoral.
Did you hear that, bureaucrats? Will is watching you. It's kind of like Santa, but it's year round with you guys. I'm curious about, because I'm call me cynical, but I'm wondering if there's some bureaucrat that's shaking in their boots, and that's why they made the decision that they did, obviously with some prompting from you. But and I'm not sure when this was announced, but Trump picked Dr. Oz to head up the CMS, and I'm wondering if, I'm wondering if this was an underling that made this decision, or if it's a reflection of whomever is, I don't even know who's the head of Centers for Medicare and Medicaid Services right now, but it'll be Dr. Oz come January.
Right. And hopefully we'll see some of these policies that they will just that they will decline to enforce in this context and in others, because we know that this problem of racially implemented policies has only been expanding in the last 4 years, and frankly, even before that. But yeah, I mean, these are the types of things where, I mean, they should be a wake up call to Americans to get their priorities straight and be voting in actors that are going to defend and further equality for all Americans. Because if we can't treat each other equally at bottom, kind of everything else is lost as well.
Well, and I
So,
like too, Cara, that Bobby Kennedy Jr., the Make
mhm.
America Healthy Again advocate, is going to be partnering with Dr. Oz, or they'll partner together to ensure these types of programs or policies, whatever you want to call them, will no longer be part of our. I mean, it, and we are talking about a taxpayer funded entity, so we should have some input into how the decisions that they are making, because I don't think any of us are. I mean, I don't anticipate a kidney transplant anytime soon, and I don't mean to make light of it, but I mean, we need to have I don't know, should we say a fair and balanced or fair and impartial federal government that is making decisions based on need as opposed to how you look on the outside?
Oh, absolutely. And I, for that matter, I believe there's currently over 100,000 people on our national transplant waiting list, with well over 80% that are waiting for a kidney. It's the most commonly needed organ. And almost 10% of that number have end-stage renal disease and are relying on routine dialysis as opposed to a normal functioning kidney process. So yes, we absolutely need um, we need health policies that are going to prioritize a patient's critical need and not their not their skin pigmentation, or any other immutable quality like that. These sex-based policies, that sort of thing. We need to be looking at individual need and circumstances to make these decisions. Absolutely.
Cara, Tolliver, thanks for joining me this morning. I know you said you'll come back and update us on something going on in Cincinnati, Ohio, and another. Well, I guess we can call ourselves the babysitters of the adult world that need to be minded when it comes to policies again that are discriminatory. And I look forward to
Yeah.
that update. So, Cara, please let me know when you are able to do so, or when you're able to at least speak about it on the air, because I know you anticipate an update soon.